Right there. Go. First appointment yesterday.
Yeah.
Really antalgic position. What that means is you're coming and holding your back, leaning over really bad, really protecting. Why don't you walk us through what happened yesterday? You shared some things with me about work.
Yeah, with work yesterday, I mean, when I came in here, I could barely walk. I was in pain. I was throwing up from the pain, crying nonstop. My lower back was in a lot of pain. And then when you adjusted me yesterday, it helped a lot.
Okay. Perfect. And already walking, I see you walking today, it's way better.
Yeah.
So share with us what happened exactly at work.
I'm not 100% sure what happened, but I mean, working construction and all, so just shoveling a lot of dirt, and then my back started to hurt, didn't really think much of it, and then by the end of the day, I could barely walk.
Yeah. And was this, were redigging trenches, or what kind of dirt shoveling were you doing?
Yeah, I was pretty much in a trench all day.
Yeah. Deep in a hole, or?
6 feet deep.
Okay. Just repetitive motion, right?
Yeah.
Now, has this ever happened before in the past?
Not to that, not that extreme.
But it has happened, maybe just a little tweak here and there?
Just a little tweak here and there,
Okay.
yeah.
How long have you been working construction?
Off and on for since I was probably about 18.
Okay.
So
Yeah.
3 years.
About 3 years or so. You're 21?
Yeah.
Okay. Yeah, absolutely. We're going to go over a few details here. I have your x-rays. We're going to review them here. We had them yesterday. Didn't get a chance to cover them with you, but let's go over them here today. There's definitely some underlying issues happening, and I love your case because the biomechanics of your spine are a little bit opposite than what they would be. So that tells me there's been actually a long-term thing happening. Now, if your paperwork that I read and my team reviewed with you yesterday was you shared a car accident. Share some details of that car accident, 2015, right? Where you went unconscious. It was such a bad accident.
Yeah, I hydroplaned through a stop sign onto a highway, and I got hit by the truck. They pretty much barely got the tail end of my car. If I would have been a little bit slower, I would have been T-boned.
Gosh.
And we spun out of control into a ditch, and none of my airbags in my car went off, and I was concussed, and I woke up in an ambulance and went to the hospital.
Yeah, well, I'm so sorry that happened to you.
Yeah.
But I'm happy you're here at least, right?
Yeah.
But traumas like that will take a huge toll on your spine.
Yeah.
And while the body's really good at adapting over time, I think we've been kind of seeing a kind of a ticking time bomb here. Where it's the little things where, normally people can shovel and do construction work without big setbacks like that.
Yeah.
But the good news is we're getting to the root cause of it. Let's jump into your x-rays and show you a few things here. The foundation of your spine is crucial. Us being weight-bearing animals, everything's positioned through our pelvis. So let's go through some details here. We have both your lateral and your E to P here. This is as if we're looking from the back side of your spine here, okay? So coming through your spine here, the left hip compared to the right hip. Now yesterday, we worked on that 5th lumbar, and we worked on the sacrum in here, okay? And right away, you had tons of improvement. You were able to stand up a lot better. Yeah. Whereas you were hunched really bad over, holding your back constantly. You showed that you were throwing up, some issues with how much pain you were in, and everything. Let's go into some details. Okay. The pelvis works in unison like this. When one side rocks and rolls, the other side compensates to that, and it's a uniform movement, correct? Okay. And so all these numbers and calculations that we put on here through the Gonstead technique here gives me to a very specific degree about how we are to correct this, okay? And what's happening mechanically with your spine. And so this left side here, your left pelvis, as if we're looking at the back side here, that side is dropped backwards and it's externally rotated. It's rotated outside, which then the right side in turn goes up and goes in like this. Now with that, these two lines, this is your 5th lumbar right here, and how it's sitting on your sacrum, that big triangle bone right here. Yeah. These two lines are supposed to be parallel with one another, but right away we have some huge rotation in this sacrum, about 5 millimeters of rotation on that right side. So we worked on that. Okay. I want to show you some details here though about what's happened. I know this has been a kind of a long thing happening, and some underlying issues. Okay. This left side here, as if we're looking at the side of your body here, the way your 5th lumbar is positioned on your sacrum there is really backwards, and it's closing off how those nerves are communicating in the back right there. And that disc is a little bit compromised. These two lines are supposed to be parallel or pretty close to parallel with each other. So it's really open in the front, really close in the back, putting pressure on those nerves that exit out the back of the spine there. If we zoom in a little bit closer though, I don't believe that that's the root cause of it. So let me zoom in and get to some more details. Down in your sacrum, this big triangle bone right here, you actually have a situation going on where, and you shared with me you're about 21 years old. The sacrum starts to fuse at around 20 years old here. A little different for everybody at what stage that is, but as it's 5 bones, it starts fusing as one. This segment right here, the first sacral segment, is still in the middle of closing up completely. And there's an issue there, an underlying issue why it's not completely closing up. And see how there's a big V in there, and we have some change in the backs of the bone right here. This is a sacral tubercle that's happening. And so this kind of bulge that's happening on that former disc there, now starting to fuse, is causing that to pitch forward, causing your 5th lumbar to drop backwards. And as a result, we start to get a stair-step approach on every single lumbar, and that's why your back is leaning back. Now, the mechanism of shoveling bent over all day, this was just ready to go, and it might have been kind of the last straw that happened there. So multiple things we got to do. We got to fix one thing before another. We used an instrument on you yesterday to understand how and where the pressure was at, where the most inflammation is. We're going to get you checked today. I already know it looks like you're in so much better. You're already standing up. And how's standing right now? Not as bad? Okay. Let's look at some other images. Coming up through your spine, we have some uniform straightness here. So I didn't mark too much going on there. And we do have some subtle changes in your upper dorsals, your thoracics here. So that's right between your shoulder blades. If that ever feels kind of stiff right there, just because we have some changes in there. Your neck right here, you have a decent curve. This curve represents the natural curve of your neck. So you at least still have that. Can't tell you how many people have reverse curves from living in this world right here, stand down in their phones, right? Taking the curve out of the neck. That's a problem because your brain that sits up here turns in your brainstem, and spinal cord all the way down protected by these bones. You take out that curve, you lengthen it, you straighten that curve, or you reverse it. That lengthens and pulls tension globally on your brainstem, spinal cord, and all the nerves that exit globally out of this area here. This is the image where we opened your mouth there to see the first, second cervical. Again, this is right where your brainstem passes through. These two lines are supposed to be parallel with each other. We have them pretty good. Slight rotation, a little bit of divergence off to the right there. We're going to check that here today. Got to make sure that's clear so everything downstream can function and the nerves work well, okay? So let's jump into it. Let's go ahead and get you checked. Just a little pressure from this instrument here. Again, this is reading the pressure on every level of your nervous system here. Let's zero it out. Good. We get some subtle heat changes here. Good. Just like yesterday, we have a full 25-point break up on his upper cervical there. Every time right up there. Good. So that's a perfect example of where there's some pressure up on his upper first and second cervical right there. So we're going to do some work. I know we didn't work on your neck yesterday, trying to focus everything here. Already your posture is completely different. That subtle curve that was in your back yesterday is gone. You're able to sit up way better, so that's good. Let's continue down. Good. So what we're finding here is my instrument is hanging out globally on this entire left side all the way down, with the biggest pressure all the way up at that first cervical right there. So what's happening right now is there's so much pressure up on his brainstem right here that is causing, instead of individual nerve pressure, where this instrument is checking every single nerve here, Anthony, there's so much pressure up top there that we got to relieve. That it's actually causing a condition called cord pressure, where globally there's whole pressure all the way down. So I'm going to just check everything still. We're going to need to clear that first, and then we'll recheck everything, make sure that your nervous system's functioning and clear. So yeah, globally through the whole thing, it's all hanging out on your left side. So we'll come back and assess all this here. Let's start on that first cervical here. We'll start with just some light palpation. If anything's tender, let me know. So I'm feeling with how it's moving compared to what it looks like on the x-rays there as well. I'm going to put the back of this chair up here. It's going to lock in place. I'm just leaning lightly against that there. tight on that left side, huh? Locked up. If we rotate you to the left and drop you in, compared to rotating to the right, drop you in, way more right there, right? Okay. Looking at your x-rays, it's a little bit different than what it looked like and appeared here. Motion pulling is going to be a little more accurate, I believe, here in this situation where that is so close that we can set it from the left side and be just fine. Okay, just because that's so bad. Your right side here, you drop down. I mean, perfectly see how much better that is.
Yeah.
All right, this chair here, we're going to utilize a strap. I'm going to stabilize you right here. Just sit up nice and tall here. Good. Feel it one more time. The more you relax here, the little bit easier. Bring your head back here. Take my contact. We're going to come right through here. And just relax right there. And let your arm down there. Perfect. How you doing?
That was a good pop.
That was good, huh?
Yeah.
Specific pop.
Yeah.
Put it in the right place here. Now what we're going to do here and jump into, lean back forward. Let's get this all checked here. So, taking off the pressure up from his upper cervical here, we're going to drop down. We're going to recheck everything here. So, instrument here. Good. So we zeroed that out completely there. Good. We have just a subtle turn. You have some swelling up top, but that zeroed it out. Perfect. So we're going to continue down your spine here. We should see that cleared all the way down. Good. We're still keeping it pretty good. Maybe just some slight heat swings. Good. We'll follow the curve of your spine naturally. So we're getting a consistent break right here. This here, getting a good 5-point break, and it's consistent every single time. I'm gonna make a mark right there. These were ones before, so we'll take those away there, mark them out. That was from the cord pressure I was seeing. But now we're seeing a standalone break every single time right through here. We're gonna come down a little more. That was an old one. Now his pelvis here, go and sit up nice and tall there. Good. We're going to go all the way down to the sacrum. I'm really interested in that sacral tubercle that I pointed out on those x-rays there. Good. All right. So we're seeing some activity here with a large, 20-point break all the way to that left there. Every single time. Every time we pass right there. So I'll mark it and we'll show you. Right. We're looking at the speed and rate every single time. So right there. Good. Lean forward just a little bit here. Alright, I'm going to come and palpate here. So we got 2 spots where we're checking after we cleared that cord pressure there. You said your sleep quality was better last night?
Yeah, it was.
Good. What we're checking here for is some swelling and edema. And as I run my fingers on your back, right at this spot right here, we have a little pitting edema here. And if we show here with the video, as I run my fingers down your back right here, his skin is really taut, as normal tissue should be. When we get to this spot here, we come down and it drops in. It gets really puffy. You can maybe see that puffiness in there. That is, let's see, we got 1, 2, 3, 4, 5, 6, 7. 7th cervical right there. So we're going to check 2 segments. I'm going to put some motion in this. How are you right here compared to the one right above right there? We'll tender on the one above. Good. So that's his 7th cervical, 7th thoracic there. Has some pressure right on it, okay? And probably really tender when I load that up, huh? Okay. Okay, we're gonna keep coming down. Alright, here. Slide to the end of the chair there, just a little bit there. Put your heels together. You're gonna butterfly open and close your knees here so I can feel how these joints are articulating and how they're moving on one another, okay? Going open and close. Good. Good, good, good. And just the right side now. Good, and left side here. Awesome. Good, that's moving just drastically better than yesterday. Yesterday there. We worked on your pelvis yesterday, got that moving better. Good. So that was your SI joints here. This is your 5th lumbar. We're gonna load your 5th lumbar here. Doing okay with that? Now this is that sacral segment right there. So that's where you start getting a reaction there. So I'm gonna load this here. How are we doing when we bring that back? Really tender, right? Okay, let's go 1 segment below. How are we doing right there? A little more here. That's what's locked up there. Okay. Let's clear this. Let's clear the foundation, and we'll come back up to your 7th thoracic here. Okay. Perfect. Looking at your X-rays, we're going to compare. We're going to work on that right side of that first sacral segment. Okay, that sacral tubercle. So straight right here. We're going to bend this top leg right here. Perfect. Good. You're way easier to get in this position. We're going to keep your arms folded right here. Good. If you remember, I'm going to subtly move you over. Don't worry, I will not drop you. We're going to bring your pelvis up closer here. Good, right there. All right. We're going to lower your waistband here. Always skin on skin. Don't want to slip on your pants here, so we can be as specific as possible. So I'm going to check how it's moving first here. We're going to be very specific on the segment. All right, here's his 5th lumbar right there. We're going to drop 1 down. A little notch is his first sacral segment. We're going to come right below. Contact right there. Good. Roll you all together. Right there. Right there. Perfect. Good. Come on up here. Swing your feet down. Come stand all the way up. Here we are. What we're looking for here is how those joints are moving in relationship. Going to rotate. Good. How are they swinging through? All right. All right. Yep. Going to head back. Good. 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 Yesterday we worked on 2 segments to really do everything up. Come have a seat here. We're gonna check it. Good. Sit nice and tall there. Good, that cleared it. Absolutely amazing. So we completely zeroed that out right there, down to the sacrum. So that was a first sacral segment, a lot of movement, right? So what's going to be happening now is your body's going to start adapting to that change we put in there, restoring normal motion. Still just a little bit tight. It's going to free up and really loosen up, okay? We're going to motion a few things so I can really feel. Good. You loaded that last time. Not near as bad. You're not fighting me near as bad now. How's that doing? Doing all right? We're going to work on this left hip again here. Yesterday we did that, where that's what unlocked everything. You need to correct that sacral segment first. Now let's work on this left hip as the mechanics of your pelvis so you can start swinging through. This is a left PIEX ilium here. We're going to rotate it. Good. Shoulders are perfect. Bring your pelvis a little bit closer here. Perfect. Keep that leg straight. Good. Head neutral there. And just look straight forward there. Relax there. Work with a lift to take out the posterior inferior and then the torque to take the external ilium out right there. Go. Good. Come on up. That's the one that does it for you. That's what gives you relief there. Let's have you walk again. This way you're moving is way better already. Yeah, definitely. Good. Tell me, walk me through. What are you feeling?
I'm feeling a whole lot of pain, so that's good.
Good. How's that left hip swinging through now? How has the numbness been since yesterday? I know we had numbness in both legs all the way down.
It wasn't too bad yesterday after I left.
After the adjustment, that numbness cleared up?
Yeah, it cleared up quite a bit.
Good. Did you wake up with any more this morning?
A little bit, yeah.
Okay. But at what? How severe compared to yesterday?
Not nearly as severe as yesterday.
Okay. Good. Perfect. So we completely cleared everything here. We're going to come back up to this 7th. Sit up nice and tall so we can check here. Good. Still getting a pretty predominant, good 5-point break there on that 7th thoracic. Good. 6, 7. Good. The way that 7th thoracic is sitting is a PLI-T. So we're gonna be on the right side. He has a slight convexity on this side here. 1, 2, 3, 4, 5, 6, 7. Now lift. This takes a clockwise rotation on that transverse belly down there. Just take a big breath and let that just fall down there. Lift your chin slightly there. Yeah, right there. All the way down, all the way. Here we are right there. Good, right there. Perfect. Good, coming up for me. Good. Perfect. Zero that out. Let's recheck everything. Good. Cleared. Cleared. Perfect. Good. That's so much better. Awesome. All right, that's gonna be it there. I'm excited for your cat. Still do some icing.
Okay.
We talked about icing there. That's gonna decrease the amount of swelling that's happening down in that pelvis there.